My name's Katie Green, and this is my informative speech, and here is my audience.
Kara Hinch,
Stephanie Condra,
Linda Cohen,
Madison Flaschenberg,
Liz Snyder,
Tim Bright.
Susie Kennedy.
Did you know breast cancer is the second leading cause of cancer death in women? 2.4 million women living in the United States today have been diagnosed with and treated for invasive breast cancer. In 2009, an estimate of 192,370 new cases of invasive breast cancer will be diagnosed in women and 1,990 in men. An estimate of 40,170 deaths for women and 450 for men. However, breast cancer death rates are increasing. Chance of a woman having invasive breast cancer is about 1 in 8, and a chance of dying is about 1 in 35. 96% of women who find out that they have breast cancer and treat it early will be cancer-free for about 5 years. 71% of black women and 86% of white women who are diagnosed experience a 5-year survival rate. What is breast cancer? Every day, cells in your body divide, grow, and die. Most of the time, cells divide and grow in an orderly manner. However, sometimes cells do grow out of control. This kind of growth of cells forms a mass or lumps, which is called a tumor. Benign tumors are not cancerous, but if not treated, some can pose a health risk, and the cells of a benign tumor will not invade nearby tissue or other parts of the body. However, malignant tumors are cancerous. They are made of abnormal cells. Those cells can invade tissue and spread to other parts of the body. Remember, cells may be growing out of control before any symptoms of the disease may appear. What causes breast cancer? The exact cause of breast cancer is still not known. However, certain risk factors are known that may put you at a higher risk. One of them is the gender, female obviously being the greatest higher risk. The second is age. 95% of new cases and 97% of deaths occur in women age 40 and older. The risk factor increases for women whose parent, sibling, or child has had the disease. Other risk factors include inherited mutations in the genes, high tissue density, high dose radiation to the chest wall, and long menstrual history. How does breast cancer grow and spread? Malignant tumors need to be fed for the growth to continue. They get nourishment by developing new blood cells in a process called angiogenesis. Angiogenesis is new blood vessels supply the tumor with nutrients that promote growth. As the malignant tumor grows, it can expand to nearby tissue. This process is called invasion. In invasion, cells break away from the primary or main tumor and spread to other parts of the body. The cells spread by traveling through the bloodstream and lymphatic system. Malignant cells appear in a new location, and they begin to divide and grow out of control again as they create another tumor. And this process will just continue throughout the rest of your body. Why does breast cancer grow? When our genes don't divide and grow properly, a genetic error or mutation has occurred. Mutations may be inherited or spontaneous. Inherited mutations are ones you were born with. Those are an abnormal gene that can be passed on from your parents. Spontaneous mutations occur within your body during your lifetime. The actual cause or causes of mutations are still unknown. researchers have identified two types of genes that are important to cell growth. One type of gene is called oncogene. The oncogene turns on or starts normal cell growth and division. If damaged, the gene does not stop when it should, and cell growth will continue to go throughout your body out of control. The second type of gene is called the tumor suppressor gene. This gene turns off or stops normal cell division and growth. If damaged, the gene does not work and the cell growth will still continue to spread throughout your body. What are types of breast cancer? One type, the most common, is called invasive ductal carcinoma. It accounts for about 80% of the invasive breast cancers. It starts in the milk duct and then breaks through the wall and invades the faulty tissue. Another type is called the ductal carcinoma in situ, also known as DCIS. DCIS is a cancer that hasn't spread from the milk duct to nearby tissue. It is almost always curable. A third kind is called infiltrating lobular carcinoma, which is the second highest kind of invasive cancer. This cancer begins in the lobules of the breast and has spread to surrounding tissues or the rest of the body. It accounts for 10% of the invasive cancers. A fourth type is called lobular carcinoma in situ, also known as LCIS. LCIS isn't a true cancer. It is only in the lobules of the breast without any spreading. However, it is a marker for increased risk of developing breast cancer later if not treated when spotted. All of the information I just provided is why breast cancer screening to find early stages is so important. You are never too young to develop breast cancer. The sooner the problem, if there is one, is found, the better a man's or woman's chances are of survival. Thanks.